Greetings, I'm Dr. Karl Nath, the Editor-in-Chief of Mayo Clinic Proceedings, and I'm pleased to welcome you to the multimedia summary for the journal's April 2021 issue. There are 5 articles, 4 of which focus on COVID-19, that have been selected as our Editor's Choice or Highlights articles this month. Our Editor's Choice this month encompasses 2 articles that relate to relevant aspects of the current pandemic. The perspective entitled The Yin and Yang of SARS-CoV-2 Mutation and Evolution is authored by Dr. Andrew Badley from Mayo Clinic in Rochester, Minnesota. The original article entitled Adherence to Public Health Measures Mitigates the Risk of COVID-19 Infection in Older Adults, a community-based study, is authored by Dr. Young Jun from the Department of Pediatrics and Adolescent Medicine at Mayo Clinic in Rochester, Minnesota, and colleagues from several other departments at Mayo Clinic Rochester, and from GlaxoSmithKline in Wavre, Belgium. The emergence of distinct SARS-CoV-2 strains in several countries has led to pressing and timely considerations regarding strategies that aim to confer viral immunity and to contain viral spread. In his perspective, Badley distills essential concepts regarding the infectivity and pathobiology of SARS-CoV-2 and how viral mutation may influence such processes. Following entry into host cells, the virus commandeers cellular machinery into viral replication, leading ultimately to the extracellular release of offspring virions and viral spread to vicinal cells. Viral mutants are inevitably produced because of seemingly inherent error-prone behavior of the replicative processes, thereby failing to faithfully recreate the original invading virus. As emphasized by Badley, mutations may influence at least 5 major properties and/or behaviors of SARS-CoV-2 relevant to the severity of COVID-19 and its treatment. And these include replicative fitness, infectivity, disease-provoking capability, responsivity to antiviral agents, and susceptibility to antibody neutralization. A specific mutation may exert countervailing effects, for example, producing strains that may more likely escape from the effects of antiviral agents or neutralizing antibodies on the one hand, but on the other, ones concomitantly compromised in their replicative fitness and thus in propagating themselves. It is this integrative effect of a given mutation on these 5 major processes that ultimately determines whether such a mutation creates a more virulent, fecund strain, thereby promoting the persistence of the pandemic, or a strain with impaired reproductive fitness, and thus one that will attrite with time. Badley frames his discussion between 2 quite sobering concepts. The first is that the potential for the appearance of a vast number of SARS-CoV-2 mutants is great because of the intrinsic propensity for missteps in the replicative machinery. And second, the longer the COVID-19 pandemic persists, the greater the likelihood of the emergence of mutant strains that are robust, replicative, and resistant to available therapeutic strategies. A corollary to this latter concept is that measures that restrain the spread and duration of COVID-19 may decrease the likelihood of the emergence of such mutant strains. And in this regard, Badley underscores public health measures as one of the 4 major ways to restrain the pandemic and the appearance of viral mutants. Germane to this consideration is the original article by Jun et al. In the same issue of Mayo Clinic Proceedings. Jun et al. Examined the prevalence of SARS-CoV-2 positivity in over 1,500 subjects after the stay-at-home orders were rescinded. In this cohort, virtually all participants adhered to recommended public health measures, namely social distancing, wearing a face mask in public, hand hygiene, staying at home, and none were positive for SARS-CoV-2. Interestingly, the prevalence of other seasonal non-SARS-CoV-2 coronaviral infections was higher than the national average, namely 7% versus 4%. These observations by June et al. Are important because they speak to personal responsibility and behavior during the current pandemic. While the stochastic and seemingly inevitable cellular errors in replication that cause viral mutation are beyond our control, public health measures that constrain viral spread are entirely within our grasp, and such measures are ones that we must assuredly follow. Our first highlight article this month contains two original articles examining risk factors for hospitalization and poor outcomes in COVID-19. The first, obesity is a major risk factor for hospitalization and community-managed COVID-19 pneumonia, is authored by Dr. Marcello Cottini from the Allergy and Clinical Immunology Outpatient Clinic in Bergamo, Italy, and colleagues from Brescia, Italy, and Mayo Clinic in Rochester, Minnesota, on behalf of the Primary Care Physicians ATS Province of Bergamo, Italy. The second, cardiac abnormalities in COVID-19 and relationship to outcome, is authored by Dr. Hema Krishna and colleagues from Mayo Clinic in Rochester, Minnesota, and Scottsdale, Arizona. The need for hospitalization usually indicates an escalation in the severity of medical conditions, and being able to predict who is at such risk and to prognosticate on possible outcomes aids the management of such diseases. Cottini et al. Report on BMI-associated outcomes in patients with COVID-19 pneumonia, diagnosed by CT scan, occurring during the months of March-April 2020 in the province of Bergamo, Italy, a province with among the highest rates of COVID-19 and attendant mortality at the time. In the population of 338 patients, 39% and 23% were overweight and obese respectively, with some 31% being hospitalized. The need for hospitalization occurred earlier in obese patients as compared with overweight and normal weight individuals, and obese patients were also at greater risk for hospitalization as compared with those groups. Moreover, obese patients exhibited more progressive disease when hospitalized, with higher rates of non-invasive and invasive ventilation and mortality. When managed outside the hospital setting, obese patients more frequently required oxygen therapy. The study by Krishna et al. Describes an association of echocardiographic findings with 30-day outcomes in patients hospitalized because of COVID-19. This study involved 179 patients in whom a transthoracic echocardiogram was needed in the course of clinical management. Such studies were undertaken at the patient's bedside and complied with a standardized abbreviated protocol so as to minimize patient contact. 30-day outcomes included prolonged hospitalization, that is greater than 21 days, and death, with such outcomes occurring in 24% and 15% of patients respectively. 36% and 26% required mechanical ventilation and circulatory support respectively. Echocardiographic abnormalities were not infrequently detected, with reduced left ventricular ejection fraction, regional wall motion abnormalities, and increased right ventricular systolic pressures present in 16%, 15%, and 25% of patients respectively. In a multivariable model, right ventricular systolic pressure was one of the main risk factors, others being previous cardiovascular disease, levels of troponin, and D-dimer that associated with the composite 30-day outcome. A notable finding by Krishna et al. Is that in those patients in whom a prior echocardiogram was available, before these patients developed COVID-19, abnormalities were present in 78% of these patients. This latter finding supports the view that cardiovascular disease may predispose to adverse outcomes in COVID-19, and that the detection of echocardiographic abnormalities in patients with COVID-19 may not necessarily be ascribed to COVID-19 per se. These two studies thus point to obesity and specific echocardiographic findings as possible indicators of a worsening course in COVID-19. Our second highlight this month is a contribution to the thematic review on women's health that is entitled Chronic Coronary Syndromes in Women, Challenges in Diagnosis and Management. It is authored by Dr. Matthias Mayo from the Division of Cardiology at Schreemli Hospital in Zurich, Switzerland. It is increasingly recognized that the manifestations of disease and response to therapy are significantly influenced by sex and gender. Mayo provides a comprehensive and timely review of how these determinants apply to chronic coronary syndromes. Such syndromes arise from obstructive epicardial coronary artery disease, coronary microvascular disease, or the coexistence of these two pathologic entities. Because of the vasoprotective effects of estrogens in premenopausal women, obstructive epicardial coronary artery disease tends to occur in women in the later menopausal years and at a considerably older age and with more comorbidities as compared with the occurrence of this disease in men. However, women are vulnerable to coronary microvascular disease in the early menopausal years as the vasoprotective effects of estrogens are lost and other risk factors become apparent, namely hypertension, diabetes, dyslipidemia, obesity, and the long-term vasculopathic effects of prior hypertensive disorders of pregnancy. Coronary microvascular disease reflects such underlying processes as endothelial dysfunction, an imbalance between microvascular vasodilation and vasoconstriction, and microvascular remodeling. Indeed, coronary microvascular disease underlies the entity termed ischemia with no obstructive coronary artery disease, which may give rise to debilitating symptoms and impaired functionality, and may predispose to overt cardiovascular events. Mayo sequentially reviews the following topics, especially as they apply to women. First, the evaluation of the risk of obstructive coronary artery disease in symptomatic women, and where indicated, additional diagnostic tests that may be pursued. Second, the relative specificity and value of various tests for epicardial and microvascular disease. Third, issues surrounding the diagnosis and management of ischemia with no obstructive coronary artery disease. Fourth, outcomes following revascularization for obstructive coronary artery disease. And finally, sex-based differences in the pharmacokinetics and pharmacodynamics of drugs commonly used in cardiovascular disease. As emphasized by Mayo, women have been insufficiently represented in clinical trials in cardiovascular disease, such that the accrued evidence which informs diagnostic algorithms and management guidelines in women is incomplete. This timely review by Mayo is important because it attunes us to the need to recognize chronic coronary syndromes as they occur in women, and it informs us on the relevant aspects of manifestations, consequences, diagnostic evaluation, and management. You can access these highlights and editor's choice articles free of charge during the entire month of April. When you visit our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org, you will find links to our social media by clicking the buttons at the bottom of any page to follow us on Facebook, Twitter, and YouTube. On our YouTube channel, you'd find full-length author interviews called Insights, 60 seconds video article synopses, and our Mayo Clinic Proceedings issue summary and Author Insights podcast recordings, which are available from our website on the homepage as well as through iTunes. You will also find our online-only feature, Pioneers and Legends in Medicine, which are video interviews of people who have made a strong impact in their field of study. You will see many news stories on our website that are based on articles published in Mayo Clinic Proceedings. And finally, you will see other free content and articles published online ahead of print. As always, we greatly thank you for your interest in and your support of Mayo Clinic Proceedings. We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.